Hello, and welcome to a very special segment of the Smile Now podcast, where we are doing Ask the Expert. I'm joined here with Dr. Caleb Stott, my partner here at Smile Now, and we have been scouring the internet, going through all kinds of dental implant discussion groups, Reddit, Facebook, questions that we've been asked personally on Instagram and things like that, and trying to provide some answers coming from a doctor, but are intended to be directly to patients to talk to some of you questions you may have concerning your implant treatment, things that can happen throughout the process, things to know beforehand. And we just want to give a really good layman's explanation of these things with still the expertise that we bring to the table doing this kind of thing every day. Dr. Stott, thanks for joining me.
Yeah. Hey, thanks, Tyler. Happy to be here.
Awesome. So I guess we'll just kind of go on through it. So Dr. Stott and I, we have both kind of done some homework and grabbed some questions from around the internet, and we have them on our phones here. So we're just going to be reading them off, and we'll kind of give our initial spiel, and then we'll give the other an opportunity to also respond to it. We'll have a little conversation based off of that, and hopefully we find these things helpful. So why don't you go ahead and get us started, Dr. Stott, with your first
Yeah,
one?
totally. Well, I mean, and you kind of explained this, like the importance of somebody like this doing this is, first of all, there's a lot of information out there nowadays. Like we live in a digital age
Yeah.
where information is abundant, accessible.
Mhm.
And it's always difficult sometimes to get onto a forum or like a Facebook group and see a lot of different opinions on, what I would consider to be accurate or inaccurate. And a lot of times, like, patients are really, really close to sharing their experience and sharing like why they feel the way that they did. And sometimes I just feel like with a little bit of nuance, we can dial that in and have a little bit of a better explanation from somebody that has placed thousands and thousands of implants, somebody that's done the types of treatments that they're talking about. So I'm really excited to be able to do this, and I think it's going to be really, really beneficial for people that are looking to do these treatments and looking to somebody that can help them out. So awesome. Most of these questions come from all over the internet. So part of our job is to be aware of what patients are thinking and what they're feeling and everything like that. And looking online is one of the best ways to really understand what kind of information they're looking for. Okay. So first question, you ready?
I'm ready.
Can you get implants if you have no teeth?
Okay.
So perfect question, right? In fact, I would say that implants are designed as a tooth replacement. They're not designed to replace healthy teeth. That would be what I'd say. There is some nuance to that. There are situations in which you don't have enough healthy teeth, and you don't want to go and replace every single tooth with an implant that you're missing and keep the teeth that you have remaining. That used to be something that implantologists did, or I would say maybe like 15 years ago. Like we'll have patients come in, you've probably seen these x-rays, right? Where they have, they're missing 20 of their 24 teeth, right? And they have like 4 teeth remaining. And then they have, 8 or 10 additional implants to replace almost every single tooth. Have you seen stuff like that?
All the time. I see them all the time, and patients are usually pretty averse to getting more implants at that point because they just feel like they've just been on this hamster wheel of getting each tooth replaced by a single implant again and again and again. They've gone through this process so many times. They get very disenchanted with it pretty quickly.
Oh, and I think they should. I would say today, nobody really approaches full mouth rehabilitations, is what they call them, that same way, right? Like we're not replacing every single tooth with one implant. And there's a lot of really good reasons for that. So like a couple good reasons is blood flow, right? So bone is a tissue, and bone has blood flow going through it. And in order to stay healthy long term, you need as much blood flow as possible. Without blood, think about diabetes, right? Like one of the consequences of diabetes is your vasculature stenoses or gets really stiff. And then what happens is you don't get as much blood flow to your peripherals, like your fingers, your toes, your legs. And then what happens to people that have diabetes long-term, chronic diabetes?
For sure.
Yeah.
Well, you lose toes, you can go blind. I mean,
Yeah.
all those things on the periphery, they're gone, and teeth are kind of a part of that as well.
Perfect. Yeah. So the same thing, like within your bone, you want healthy blood flow. And if you're placing medical grade titanium implants in your bone, and they're spaced too close together, you just have less vasculature to keep those healthy long term. So all these old x-rays that we used to see where people had like 10 implants to restore all their teeth up top, nobody does that anymore. We know it's inappropriate now. And there's a much, much better way. So like going back to the question, I just like huge segue, right?
No, good context for sure.
Right. But going back to it, like if you have no teeth, can you get implants? Yeah, absolutely. That's what they're designed for. Implants are the number one tooth replacement option that we have today, period. You're not going to get the same quality of life, the high quality of being able to like be in public, happy with your smile, chew food, leave your palate uncovered so you can taste food and everything like that without implants. You just cannot do it without something like implants. So they are designed primarily for people with no teeth. I would say that.
Yeah. And I will say too is, I think I'm sure that it's a regular occurrence in our offices where someone comes in, they haven't had teeth for some time. And, you might ask them, well, why have you been at dentures for so long if you've hated them, right? Like, let's say they just haven't been able to eat what they want, or they hate having the palate on their upper denture or something like that. They said, well, I talked to my dentist about getting implants, but they just told me I didn't have enough bone. So they just kind of sat there in this denture for years and years, losing more and more bone, because that's what happens when you have a denture. And now they have less bone they started with. And believe it or not, they're actually still candidates, because if someone who has the lens of a full mouth rehabilitation implant doctor, you know that you don't need the same amount of bone to replace all those teeth as you do if you're just replacing one tooth, which is a little counterintuitive. But we can utilize the bone that you have remaining to replace all the teeth, given some of the modalities that we talk about. And so a lot of times that's kind of counterintuitive for patients. They get a little confused about that. But the most important thing is to understand, if you have no teeth, you are just about the best candidate that could be for a dental implant, because you need your whole mouth back and your whole body has been affected by not having teeth. So you're the number one person that we want to make sure we're helping.
Yeah, I agree. In fact, I tell patients all the time, if I had a chance, if I had the opportunity to choose what part of my body I'm going to lose, right? And it was between like my teeth and my left hand, I would choose my left hand. I would choose to
That's fair.
keep my teeth over,
Mhm.
over one of my feet. Or,
Yeah.
I'd lose a leg below the knee before I would lose all my teeth, just because it means so much more to you, right? Like nutrition, social, social anxieties that come from not having teeth, mental health, everything that goes along with it. It's just so
Mhm.
hard, and it's just not
Yep.
fair. And you can live without a lot of stuff, but you can't live without your teeth. So,
I totally agree with that. Well said. All right, my turn.
okay.
So I got one here. So the question is, has anyone had the FP1 upper done? Do you like them? Are you happy? And send some pics if you have them. So first, before we really get into answering that question, I think we kind of need to talk about this whole FP1, FP3 thing. This is one of those situations where I think sometimes maybe dentists aren't the best at communicating the things that we talk about to people in like common language. So in general, what FP1 means is that we're using implants. The implants are all essentially the same, but we're using it to replace just the tooth itself, the white part, the tooth, the thing that we know to be teeth. It's totally irrespective of the gums and the bone underlying that. Yes, we have to think about those things, but the actual prosthetic thing, the fake thing, the thing that's replacing your former teeth, it's just going to be teeth. And then when we mention FP3, we kind of skipped a two there. We can talk about that, but it's not super necessary. The FP3 is kind of a different approach, where more has been lost, or maybe something has undergone to where we had to level off the bone and kind of create a whole new foundation because there was a bunch of destruction and tooth loss over time. And we've actually replaced not just the teeth, but also some of the gums and some of where that bone used to be as well. And so the prosthetic that you get, it's not just teeth, it's got the pink part above that as well. So it looks a little bit thicker and it wraps all the way around the arch. And so that's an FP3 prosthesis. So the simplest way to think about that is FP1, just the teeth, FP3, teeth and the gums. So these can look very different, and the way that we approach these things can be very different as doctors, but I think that's just kind of an important thing to sort of understand. So to give a little bit more context now to sort of bring us into the present, FP3 is kind of like what's been happening over the past 10 to 15 years when you talk about full arch rehabilitation. Most people are doing FP3 prostheses. A lot of the big companies out there, Clear Choice, Nuvi, you've probably seen their commercials and things. They've been doing FP3 a long time, whereas FP1, while it's not exactly new, it's becoming a lot more commonplace as a full mouth replacement because there are a lot of systems that have come about to make that a lot more simplistic, just to replace your natural teeth. Why might you want that, right? That's an important question. Well, the reason you might want that is because maybe you're missing some teeth. Maybe the teeth you have are very broken down, but the underlying bone is actually still pretty healthy. You have good architecture in that bone, and you just want to replace where the teeth were. So now you're going to place the implants a little bit. Your dentist is going to place the implants a little bit shallower, just to replace the teeth themselves and have them go in between your natural gums to give you a more natural looking and feeling smile. There's a lot less bulk. It can be a little bit more cosmetic as well. Some patients are great candidates for this, some people not so much. And it's really, really important that you have that kind of conversation with a doctor and that your doctor know the nuances between the two things. You don't want to be kind of put into a box that you don't necessarily belong in, and you want to understand the advantages of going one way or the other. So that's probably the most like simplistic answer I think I can muster for that. Caleb, what do you
Yeah.
got?
No, I mean, you did a really good job, right? So, FP1, a little bit of context, like there's actually three different classifications for fixed prosthesis, and that's what the
Yeah.
FP and FP1 stands for, right?
Yeah.
So, one of the godfathers of implantology, his name is Carl Misch, and he categorized these, um, 20 years ago. And basically, he said FP1, FP2, or FP3 are the three different types of teeth that you can get, and you just explained one and three really, really well.
Hmm.
Um, when we're talking about like pink porcelain or replacing the gums, that's just for aesthetic reasons, right? It really doesn't have any function other than it just looks better to the eye when people smile, and their teeth otherwise would look bigger if
Hmm.
they didn't have the pink porcelain, right? So,
Right.
it's just for aesthetic reasons. It doesn't make it stronger. It doesn't make it weaker. It does nothing but makes it look aesthetically pleasing, right?
Agreed.
When it comes into play, though, is you do FP3 is more for people that have lost bone, right? So we see
Hmm.
patients all the time. They've had periodontitis for years and years and years. The body has already eroded away the bone significantly. And then all of a sudden they want to replace their teeth with implants, which works perfectly fine. But they're concerned about things that get talked about nowadays about like how much bone are you removing? I'm just replacing the tooth structure and that's it. How bulky is the prosthesis? But there's no one size fits all. Like there's a lot of talk out there. Look, this is a raging debate among dentists, right?
Yeah, it
And
is. It's still a very active
there's a
conversation.
lot of talk of which one is the best. But my philosophy is neither one's the best because neither one is specific to everybody, right?
Hmm.
And if I have, so like, who do you think would qualify better for an FP1? Which I would say the benefits are less bone removal, maintain natural gums, like the your natural gums, so you don't have the pink porcelain, which is great, right? Um, and then, but there's some other aspects, like who do you think best qualifies for an FP1 or even a 3-on-6? Because we're now
Hmm.
3-on-6 providers, and they're very, very similar in nature. Who's the best person for these types of procedures?
The one that comes to my mind most often is a very young patient who just has really broken down teeth. They've still got most of their teeth, but there's a lot of decay, and there's just so much that would have to be done to fix those teeth and keep those natural teeth that it's starting to not necessarily make a whole lot of sense. And so now what we can do is get those teeth out, preserve the natural bone that's there, and replace them just the teeth themselves, and that gives more bone for later. Should something happen, should any complications arise, obviously we get older, we fall under, certain things can happen nutritionally, we might develop a disease or something like that, whatever. You want to have some real estate left in the body and the jaw bones to, potentially have more implants down the road and have more options and preserve those. So I think of the young patient first of all.
Okay, so another question I have. Had my extractions in July, got flipper teeth until healing for implants. Two of my hooks already broke off. WTF? I, which is, it's totally
It's
fair.
super
Like
frustrating, I'm sure.
you feel so much frustration when stuff isn't going well. I'm having to use denture cream. Dentist pretty much told me it was my fault and that I would have to pay to repair them. Don't see me getting implants till maybe December. Anyone else have this issue? 37,000 should have just gotten dentures.
Mhm.
Yeah, and so first of all, like I read this and I'm probably as frustrated as that patient is.
Yeah.
Like, oh my gosh, right? You're gonna pay that much money, and then you're gonna have um, incomplete treatments and have to deal with that for months and months and months, if not like years. Like I've seen cases of people stuck in limbo with their treatment for years. And I don't know what the situation is. I just know that like standard of care should be something that people can live with and function with and not have to deal with kind of like the fallout of maybe me not being prepared if I was to do that type of treatment, right?
Yeah, I agree. And when I hear that someone spent, $37,000 on it, that's getting into the ballpark of what a full mouth replacement looks like. And it sounds like they had their teeth pulled out, but they didn't get their implants the same day. and they had to wear a flipper for some time, which means that some natural teeth were left as well. So it kind of sounds like this was not necessarily a full mouth rehabilitation. They were trying to replace several teeth, and instead of doing an immediate, temporary or provisional, as we call it, they were just given, extractions, maybe a bone graft, a flipper to wear for some time. Then they're going to come back and do the implants. This is something that we have really worked hard to solve. So when we have patients that are missing a lot of teeth, we are making a point to take out remaining teeth, take out whatever's there, put in implants right away, and have teeth at the same time. So you're going to leave with those teeth already, and you've splinted together all those implants. It's going to help them heal. It's going to be like a cast on a broken bone. So you have teeth throughout your whole process. It's not nearly as frustrating, and it's actually pretty predictable as far as, the bone healing and the implants and everything. This is what we were trying to move away from. The way it used to be done was you get your teeth pulled, you get them grafted, you get sent to a specialist, you get your implants, you wear a denture for however long, come back, and then there's a secondary surgery, and then something else is attached, and then we take new records. It'd be like 10, 12 appointments between multiple providers. Extremely expensive, not fun for the patient throughout the process, and not nearly as predictable at the end of the day. So this is why we started doing what we do at Smile Now. And, it just sounds like this may have been sort of a more archaic approach to replacing someone's missing teeth.
Yeah, I mean, I agree with all that. We saw a huge need for people to receive affordable and treatment that I think is commiserate with the time that we live in, right? So I agree. Like phasing treatments out over, almost a year,
Mm-hmm.
and even like keeping some teeth. Like if you're getting a flipper, first of all, like you might have the majority of your teeth, you might not have very many teeth out. Um, or you might have the majority of your teeth out. So it just like really depends on your situation, and it's hard to speak to this one specifically. But I would say that if there was ever a time to be a patient and receive treatments that can really like renovate your life, that today is the day to get that done, because digital dentistry is alive and well and been around for a long time and doing super great. 3D printing in dentistry has really come on strong in like the last, I would say, 3 to 4 years.
Right.
Just the materials that we have to work with are phenomenal, and the innovation that companies are coming up with to be able to solve the problems that took a long time and took multiple appointments is solved at this point. And then being able to get like just a solid treatment, same day treatment, walk out with teeth, like this is alive and well. And I would say that kind of the sweet spot as far as cost goes for that is pretty close to what they paid according to their post too. So super big bummer. I wish I could see the x-rays. I wish I could see pictures. I wish I could know more about the case, because I could speak very specific to what that person's going to and talk to them about their options. It's online you just don't get that a lot of times, so we can't really do that in this situation. But I'd be frustrated too if I was going through what they are. And it's never okay also for a dentist just to kind of like blame everything on the patient and say it's all their fault. I
Mm-hmm.
don't believe we're here to give of our expertise, but also our health and our support for people that are going through a really hard time in their life. And sometimes us as dentists, we got to remember to do that better than what we're doing.
Couldn't agree more.
Implant dentistry is a lot. Dentistry in general is a lot, and it is really difficult to get all the information, get really good information. And that's why I'm glad we're doing these segments for patients primarily, is to help them. And I hope that when they see this, if they have any specific questions, they just drop it down in the comments for us. If you want to send us x-rays, if you want to like kind of get like a second look on something, we'd be happy to put that on these segments and kind of speak to you directly if that's beneficial to you.